All right. Good afternoon, everyone. It is noon Central Time here, and so we are going to get started. My name is Kylie Hall. I am the Operations Director at the North Dakota State University Center for Immunization Research and Education. And today I have the absolute pleasure to introduce Dr. David Higgins, who's going to be presenting this really timely webinar titled School Immunization Requirements, Evidence, Policy, and Communication in a Shifting Landscape. A little bit about Dr. Higgins to start here. Dr. Higgins is an assistant professor of pediatrics and public health at the University of Colorado School of Medicine and Colorado School of Public Health. His work focuses on vaccine delivery, communication, and immunization policy, and he continues to practice pediatrics at Children's Hospital, Colorado. Dr. Higgins serves as president-elect of the Colorado chapter of the American Academy of Pediatrics and is involved in statewide vaccine policy and advocacy efforts through Immunize Colorado and Colorado Chooses Vaccines. He's a regular contributor to Unbiased Science and serves on the steering committee for the Evidence Collective, where he works to translate complex scientific evidence into clear, accessible guidance for clinicians, policymakers, and the public. He writes a regular newsletter on these topics at Community Immunity on Substack. Would definitely recommend following him if you're not already. And his commentary and analysis have been featured in the New York Times, the Washington Post, the Wall Street Journal, and other national outlets. We're so excited to have him here to present this webinar today. Dr. Higgins, I think we've gone through all of the housekeeping items, so you can go ahead and begin.
Great. Thank you so much. And thank you so much for the invitation to be with you all today. I'm excited for this talk. As everyone on this webinar knows, this is a moment when school immunization requirements are under real pressure, and we are having conversations about them frequently. And today, what I would really want to do is cover where they came from, what the evidence says, what's happening now, and probably most importantly, how do we talk about it? Now, I really hope that this presentation is helpful for you, whether you're a clinician, whether you're a school nurse, you're a public health practitioner, an advocate, or you're just interested. I hope that there's something really useful here for all of you. I'm going to start by just saying I have no disclosures. Okay, so here are the objectives. I want to describe the historical development and current landscape of immunization requirements in the U.S., including criteria for inclusion and exemption policies. I want to discuss the evidence on how immunization requirements reduce vaccine-preventable diseases, including their role as a healthcare touchpoint for children that's often overlooked. I want us to recognize current legislative and policy challenges that affect immunization requirements and their potential public health consequences. And then finally, we're going to identify evidence-based communication strategies for discussing requirements with patients, communities, and policymakers. But we need to start with the history. So before we talk about what's happening now, we need to understand where these requirements came from. And this is in part because people who are very opposed to these requirements often act as if they're new, and they're not. So starting back in 1777, George Washington mandated smallpox inoculation for the Continental Army. Okay, so this is one of the first examples of mandating or requiring an inoculation. Now, this is actually about 20 years before Edward Jenner discovered the smallpox vaccine. Okay, nevertheless, at this time, there was a medical procedure similar to vaccination. It was called inoculation or variolation. And with this, a person would receive smallpox material scraped onto them from an infected person, theoretically in a controlled way. Now, unlike catching smallpox kind of in the natural way, if you will, inoculation did cause less illness and carried a lower risk of death, but it was risky and it was actually incredibly dangerous. People that underwent this would be immune to smallpox. Okay, but this was seen as a necessity because smallpox was killing more soldiers than the British were. And the point here is that the tension between between individual liberties and collective protection is not new. It is not a 21st century invention. Okay, so let's fast forward. Now we actually have the smallpox vaccine. Okay, and in 1809, Massachusetts was the first state to mandate smallpox vaccination for the general public. In 1855, if we fast forward, Massachusetts again was the first to require smallpox vaccination for school enrollment. This is the first school vaccine requirement in the United States. So the key message here is that this has been going on for over 170 years. This is not something new or radical that we are doing. Schools have always been recognized as both a place of transmission risk and an important point of access for children. What we see in history is from the mid-1800s to the mid-1900s, all 50 states end up adopting some form of school immunization requirements. Now, requirements expanded as new vaccines were developed with polio vaccines, measles, mumps, and rubella vaccines, DTaP, hepatitis B, all of these new vaccines, requirements expanded. But what's important to recognize, and a lot of people don't understand this was not done at the federal level. It happened state by state. It reflected scientific consensus and public health recommendations that may have been made at the federal level, but this was really built state by state. Okay, now let's talk about the legal foundation briefly. Big giant caveat here. I am not a legal scholar, and there's probably on this webinar or watching this several people who are. I'm going to hit the high points, what you need to know, as most of you are not a legal scholar, but this is important for understanding. Okay, so the legal foundation for school vaccine requirements really starts in 1905 with Jacobson versus Massachusetts. Henning Jacobson was an individual who refused a required smallpox vaccine in Massachusetts and was fined $5 for this. Well, he took it to the Supreme Court, and at the Supreme Court, he lost 7-2. The court established that states have broad, quote, police power to enact reasonable public health regulations, even if they infringe on individual liberty. So you'll hear about Jacobson not only for vaccines, but this is really the foundational precedent that underpins things like quarantine authority and almost every required health measure in the United States. Opponents have been challenging this for over 120 years, and it has held. So let's fast forward to another case in 1922, where a San Antonio student was excluded from school for refusing a smallpox vaccine required by city ordinance. And this was challenged as unconstitutional. The Supreme Court in this case ruled unanimously that municipalities and not just states have authority to enforce school vaccine requirements. So put together with Jacobson that I just talked about, these really create the constitutional foundation that courts have repeatedly affirmed over 100 years. I want to mention one other case here, Prince versus Massachusetts. This case was actually unrelated to vaccination. It was about child labor laws and religion. But in this decision, the court wrote language that has been cited in vaccine cases ever since. And really the key quote here is the right to practice religion freely does not include liberty to expose the community or the child to communicable disease or the later to ill health or death. Okay, and so this really became the cornerstone argument against religious exemptions. Okay, now that's the end of my quick little legal foundation. I realize there might be legal scholars on this call that think there are 10 other cases I should have mentioned. There's a lot more in this landscape, but I think this is important just for you to know where the foundation comes from. So opposition to requirements is not also new. Requirements aren't new, and neither is opposition. This 1915 cartoon is from an anti-vaccination publication that shows how much the rhetoric hasn't changed. Okay, things like this police power framing, government overreach, bodily autonomy, personal liberty, all of these things, these arguments, they have been present for a long time. And understanding this history and how long these same themes have been around helps us to not overreact to current opposition and efforts and act as if it's unprecedented. Okay, this is the New York Times in 1882, and in this excerpt from the New York Times, you can see an opinion piece that was published by an anti-vaccine activist that really made similar arguments that you might see today. Okay, the current moment feels urgent. It does. It feels like this is new and unprecedented. But in reality, the underlying concerns and debate is deeply rooted in American history and values. And knowing this again helps us engage with patients, okay, rather than just being exasperated by this moment that seems unprecedented. Okay, now, before we go into the rest of this talk, I'm going to do something that you might find unusual. I want to just say, hey, here's some of the things that people raise as in opposition to requirements. So the case against requirements, well, one of the most common concerns is that vaccine requirements are coercive, right? I mean, they compel. It is the government or the state compelling individual to do something that they would not otherwise do. Okay, so yes, requirements do compel behavior, and the reality is all laws do. Okay, the question really isn't whether it's compelled behavior or not, it is whether it's justified. Okay, and in the case of protecting children and communities from preventable disease, it easily clears that bar. Okay, commonly we hear, well, this infringes on my liberties, right? They interfere with my liberties. Well, liberties are not absolute. I like this quote from a Supreme Court justice that the right to swing my fist ends where the other man's nose begins. And there have been different versions of this quote that have circulated, but it's this whole idea that you have liberties up to the point where your liberties start harming others. Okay. And that is kind of the foundational thing to understand when people talk about these civil liberties. Now, I'm going to get more into how we communicate well about this. This is a little bit more nuanced than I'm talking about right now, but it's important background. And I actually like flipping this a little bit and making it very clear that requirements can actually advance liberty by protecting and offering people that are immune compromised, infants, those who can't be vaccinated or for whom the vaccine didn't work. It gives them the liberty to be able to attend school in a safe environment. There are other arguments that aren't on this slide, and I'm not going to take more time to go through them. And you have heard a lot of these arguments, and I'll give you more resources at the end to dig into some of these. But I want to say one more thing that I don't think we say enough in these types of spaces. The people on the other side of these conversations are not the enemy, okay? They are our people. The neighbor who showed up at the school board meeting opposing vaccine requirements and yelling. I have been yelled at school board meetings. They're also the same person who has kids on maybe your own kid's sports team. Maybe they attend your church. Maybe they're at your neighborhood block party or at the farmer's market. This matters not just ethically, but it matters practically. Okay, because research on behavior change is consistent on this point, that people do not update their beliefs in response to contempt. When someone feels looked down on, they don't think, maybe I'm wrong about this. They think this person doesn't respect me. And they leave that community or tune out and find someone who will listen to them. And if our ultimate goal is behavior change or helping someone see our point of view, we haven't done that. So we have to see the other person or the other group that is across from us as human beings with real concerns, not simply as an obstacle to herd immunity. And I personally think that that actually makes this work that we're doing more sustainable when you see it that way. Okay, now that we know a little bit about where we came from, let's look at where we are. So every single state continues to have school immunization requirements. This is a map of measles, mumps, and rubella vaccination requirements, which are currently present in every state. However, each state has different requirements. So these maps show requirements for meningococcal disease on the left and HPV on the right. The takeaway here is that school requirements are a patchwork of requirements. There's no national standard on which vaccines are required. And so as you can see, while all states have a requirement for measles vaccine, not all states have a requirement for meningococcal vaccines, including my state here in Colorado. And then very few, only a handful, have any type of a requirement for HPV vaccine. So you're asking, well, which vaccines get required and why? And it's a good question. It's a question I hear frequently from parents, from school leaders. And there are several things to consider. So, first, kind of some of your typical inclusion criteria includes high burden in school-age children, person-to-person transmission in school settings, and strong recommendations from groups like the ACIP over the years and professional societies. Okay, and easy examples of this are things like measles and varicella, chickenpox, and pertussis, right? There are some notable exceptions that can be passed along through school and meet these requirements, but are not required in most states. So this reveals that science alone doesn't determine policy. The context matters enormously. And what's going on here? Okay, well, I'm just going to briefly say this. I think this is important for anybody that's doing work in this space to understand. Vaccine requirements are affected by the Overton window and policymaking. And if you haven't been involved in policymaking for vaccine requirements, you might not be aware of how the sausage is made, how this actually works. Okay, first, this is just a reality. The range of policy ideas that are politically acceptable is the mainstream public at a given moment in time. So this changes. Right now, if in any state tried to require COVID-19 vaccines for school attendance, that would not be acceptable to the mainstream public, right? I'm throwing that out there as an example. That would not be acceptable today in 2026 with the mainstream public. The reality is that how these decisions get made at the state level or at the city and county level includes the P's of policymaking. Who's involved? Who are the elected officials, the lobbyists, the advocates? Who's the public that's speaking up? It involves the process. Okay, the structural steps required to make this work that can get really messy. It involves the policy. What's the actual substance, the text or design of rules, regulations, and laws? And then it involves politics. I wish that we could say, let's just get politics out of this and just follow the science, but that's not the reality we're living in. The reality is we also have to deal with power dynamics and compromise because we have in our communities, in our states, we have different people with opposing views and opposing priorities of these types of things, and we have to figure out a way to work through that together. Okay, so what are the different types of exemptions? Well, there's two main categories of exemptions from school requirements. One is the medical exemption. Medical exemptions are allowed in all 50 states. This is based on documented medical contraindications. Clear examples of this: allergy to a vaccine components, a child who is undergoing chemotherapy for cancer and is severely immunosuppressed. These typically require a provider certification. And really, when they're granted appropriately, there's minimal population level impact because there is a tiny sliver of the population that has a true medical exemption or contraindication to vaccination. And then there is this category of non-medical exemptions, and that's what a lot of us are thinking about when we talk about exemptions. There are religious exemptions and philosophical or personal belief exemptions. About 45 states allow some type of religious exemption, and philosophical or personal belief exemptions, about 15 states allow this. So I just want to put this out there, and we'll talk about this a little bit later. No major world religion has specific guidance prohibiting vaccination, and yet there are religious exemptions in most states. Now, non-medical exemptions vary widely in how they're granted and enforced. And we're going to talk about this more through the remainder of the talk. So I'll get into that in more detail. But the bottom line is, if you live in a state where it's much easier to obtain one of these non-medical exemptions, you're going to have higher exemption rates and lower vaccination rates. And this is because exemptions and your non-medical exemptions are on a spectrum. So on one end of the spectrum are very rigid exemptions. Okay, in this case, you have exemptions that only allow medical exemptions, or there are religious exemptions or philosophical exemptions, but there's serious penalties for not following through with compliance. Okay, medium type of exemptions are exemptions where you can pretty easily opt out. You have to fill out a form. You might have to get that form notarized. You might have to take some education, like do an educational module. And penalties aren't routinely enforced. Okay, that's kind of that medium strength of exemption. Then there's the very flexible exemption. This is where anyone can opt out. Maybe you have to check a box on a school form. You have to say you're up to date or say that you don't want to do vaccines because you have a philosophical belief that says otherwise, and there's no penalties. There's really no extra steps. Okay, so really the middle is where most of the policy action is occurring. And we'll come back to this in just a minute. But I want to show you here, I said, that about 15 states have philosophical or personal belief exemptions and tend to have higher exemption rates. And here's a map of those. Okay, so this is from KFF, who has, if you're looking for good resources on places that are tracking this in an easily digestible way, KFF has some great resources for this. And this is just a good map that shows you which states have different types of exemptions. You'll notice that there are only several states who have only medical exemptions, and that includes California, New York, Maine, Connecticut, and maybe West Virginia. We'll talk about that one more in a minute. And here's the other thing to know. Exemption rates are rising, okay? This is data from the CDC's School Vax View, which compiles data from school reports. So a lot of people don't understand where we get some of our kindergarten vaccination rate or our kindergarten exemption rates from. This is reported at the state level, okay, to federal partners like the CDC. And each state has a different process for gathering this data from schools. Some states, including where I worked before in Montana, do not currently gather this data at all. But in general, at some point during the year, states are required to report to the state public health agency on their exemptions, on their how many kids are vaccinated and how many kids are out of compliance with vaccine requirements. Okay, now this is an upward trend. It is still low nationally. Nationally, we are still hovering right around 4%, but it is concerning that this is rising. But I want to zoom in a little bit more because the rise in exemptions is not uniform. Okay, some individual states and communities are driving the trend much more than others. And this is really important to recognize, okay, that national or state averages can mask dramatic local variation. And local pockets of under-vaccination are really where the true outbreak risk is. So maybe there's a community or county that has 93% vaccination coverage for something like measles, but at the level of a school, you're talking about 60% coverage. And if an imported case comes into that school, you're looking at an outbreak. And I want to mention this. School requirements apply to students in public and most private schools. Homeschooled children typically fall outside of that legal framework entirely. Now, there's about 3 to 4 million homeschooled students in the US. These numbers are tough to get, but what you see here is that the percent of kids that are homeschooled has been increasing. Now, each state is different. So about 26 states don't require homeschoolers to be vaccinated. 11 require it, but don't require any documentation. And so it's unclear whether that's really enforced at all. And then 9 states have mixed or conflicting requirements. And really only 4 states require homeschoolers to submit documentation. Okay, so quick knowledge check. Which statements about school immunization requirements in the United States is true? I want you to think through these answers real quick. Okay, and the answer here is B. School requirements are established at the state level. Really important that you know that, because I hear this all the time from people that someone within the federal government, a leader within the federal government, is going to change this, and it's at the level of the states. Okay, so do requirements work? Well, Dr. Caitlin Jetelina and I wrote this Substack, I think this was several months ago now, but one of the quotes that we had in here was that the most effective vaccine program in American history doesn't require a new drug or clinical trial or breakthrough. It requires a forum for school enrollment. They work, and I'll show you some of the evidence for this. So this is a recent study in JAMA Pediatrics. And what they looked at in this study was states that took away non-medical exemptions, saw meaningful increases in kindergarten vaccination rates. Okay. Now, the effect was not necessarily uniform, and implementation, access, and enforcement of this does matter and differed by state. But in general, when you take away non-medical exemptions, there's meaningful increases in vaccination. So what's also important to recognize is that it doesn't just improve vaccination of school-required vaccines. This is a study from Pediatrics in 2016 showing that states with school entry requirements for vaccines like meningococcal and Tdap vaccines also had higher HPV vaccination, even though HPV wasn't required for school. Right? The well-child visit, when kids come in for school enrollment, this creates a touch point not only to get the school-required vaccines, but also other vaccines. And this is a powerful and underappreciated benefit. Okay, so let's just talk about the example of California. All right, so I'm going to walk you through this. In 2014, there was a bill that required parents to submit proof that they had discussed the risks of not vaccinating their children with a healthcare practitioner prior to obtaining a personal belief exemption. This is a pretty low bar, right? They just had to submit proof that they had discussed the risks. Okay. In 2015, there was what's famously known as the Disneyland measles outbreak that resulted in quite a few cases, although the past 2 years are kind of putting this outbreak to shame. But in the time, it was quite a few cases across multiple states and Canada and Mexico. And following this, a new bill was passed that eliminated personal belief exemptions entirely. Okay. And subsequently, those actions have been associated with media content that framed vaccine opposition as kind of this freedom, civil liberties issue or government issue. So there was a little bit of backlash to this as well. But did it work? Well, it did. So these changes were associated with significant increases in kindergarten vaccination rates across California. Okay, and you can see that in this data here from a JAMA article in 2019. And what you see here are kids are vaccinated. You also do see a subsequent increase as philosophical exemptions, personal belief exemptions are taken away. You see a little bit of an increase in medical exemptions. Okay, but this is a much, much smaller number. So the lesson here is that elimination of non-medical exemptions works, but it requires the enforcement infrastructure and monitoring to be able to do this well. Okay, another example, not the United States, but it is informative for us. So Australia has had a very different approach, and I want to talk about this because it's a much more rigid requirement approach. Okay, in 1998. Vaccination, Australia started this no jab, no pay, okay, requirement where vaccination was linked to family assistance payments. And through 2012 through 2016, it was, linked to things like family tax benefits, childcare benefits, and childcare rebates on their taxes. This was expanded to no jab, no play, which is which is childcare enrollment requirements for vaccine requirements for childcare enrollment. Okay, so Australia has taken a very different approach. This is among one of the strongest in the world. Okay, the requirements are tied to real significant penalties for families. And as a result, they have had significant increases in vaccine coverage nationally. Okay. But I want to recognize we are not Australia. This is an example, but we are not Australia for many reasons, not only our political culture, but also things like universal healthcare. Okay, so let's look at Italy, because this is probably the most important cautionary tale in this space. Okay, so Italy for a very long time had requirements, but essentially never enforced them. And in 2013, one of Italy's courts falsely attributed the MMR vaccine to autism. And in the after this occurred, vaccine hesitancy surged and coverage just collapsed. Okay, this resulted expectedly. Okay, because with measles vaccine, as soon as the vaccination rate drops, it's not a matter of if, it's a matter of when an outbreak is going to occur. They had multiple outbreaks of measles. Now, following outbreaks of measles, a stricter law was passed requiring vaccines for schools, and it included fines for anybody who refused. Okay. Now, what happened was a year later, there was an incoming populist government that weakened it, and the pendulum swung the other way. And almost immediately, a year later, these requirements were weakened and measles surged again. So in 2019, the 2017 stricter law was reinstated and reinforced. The lesson here is that it's not just that requirements work or don't work. How you implement and sustain them matters just as much as whether you have them. So requirements put in place without public trust, without enforcement, without access are fragile. They won't last and potentially might backfire. There's also equity considerations. And this is a point that's often underemphasized in all of these debates. And I think it's important to bring up. These are data from CDC survey in 2025 of parents asking them why they sought an exemption for their children. And if you look in here, the difficulty meeting school requirements by the deadline was reported as a common reason for exemption. So this wasn't necessarily hesitancy for roughly 1 in 4 parents, but this was access. And the point here is that requirements without adequate access infrastructure, right? So if I'm a parent and I get a notification that my child needs a vaccine and I try calling to my PCP if I have one, and they say, I'm sorry, we can't get you in for that visit for months, that can be really defeating. Okay, so families with fewer resources, transportation barriers, inflexible work schedules, maybe their children don't have insurance, maybe they just moved into the state, all of them, they face greater barriers to compliance. Okay, and so if you simply make requirements stricter without addressing access, you potentially risk penalizing the families that you're trying to help. Okay, so here's a summary of this. There are potential unintended consequences of vaccine requirements. Okay, shifting or misuse of exemptions occurs, although it still is much smaller than when philosophical exemptions are in place. Backlash and erosion of public trust is a real concern. Sometimes penalties may worsen inequities and in an unintended way. And then there's this point. Sometimes there's a misperception of which vaccines are important. And I am sure if you are a practitioner and you talk to families, I'm sure you've had this, well, I only want the school required ones. And this sense that those are the important ones. Those are the ones that are really good for my child's health. The other ones, they must not be that important because the school doesn't require them. And that really is a problem and something that we have to communicate about. But this is one of the most compelling arguments that really is, again, underutilized. The school entry health visit is a broad safety net. It is not just a vaccine visit, okay? As a pediatrician, we are looking for all sorts of things: mental health concerns, developmental concerns, learning disabilities, exposure, environmental exposures, hearing and vision problems, food insecurities, signs of abuse and neglect. When families skip this visit or delay it, children miss screening and intervention opportunities across the board of their health in a holistic health way. So requirements do help encourage this extra healthcare touch point, which does a lot more than just get them up to date on their vaccines. And finally, from an economic standpoint, I think it's important to recognize that the cost of not acting. Okay, so the 2019 New York City measles outbreak is a great example of this because there have been some great studies about how much this cost. So in September of 2018, there was a single measles case that came into Brooklyn and spread through under-immunized children and adults in Orthodox Jewish communities. The public health emergency was declared, and there was vaccination was required for the community, along with a fine if the community members didn't get the vaccine. By the end of this, there were hundreds of cases, school closures, and the total cost was estimated at about $8 million to contain this. Okay. As a result of this outbreak, in part due to this outbreak, religious exemptions were eliminated in New York State. So the key message here is that requirements are, outbreaks are far more expensive than school requirements. Okay. Another quick question for you to think about. What is the primary mechanism by which school immunization requirements improve vaccination? All right, and the answer there was C. Perfect. I think I didn't have that one. Animation. Creating a nudge in healthcare touchpoint. It's really, really important to recognize that. Okay, let's just talk briefly about the shifting policy landscape. So we have seen a flurry of vaccine-related bills in the past couple of years. And there are several of them that have actually been looking to strengthen school immunization requirements. Okay, this includes things like increased reporting and auditing of vaccine records, requiring schools to publicly report vaccination rates, adding penalties for noncompliance, and enforcement. But a majority of these have been efforts to reduce the strength of school vaccine requirements. And I'm going to explain several of these in just a moment. Okay, we're going to talk about Idaho's new bill that was passed in 2015. There have been also some significant pushes in Florida and Iowa and other states not listed here. But let's talk about Idaho, because I think this is really important. This is a particularly clever legislative strategy. So in 2025, Idaho passed a medical freedom law that bars schools from conditioning enrollment on vaccination status. So it's very confusing because this didn't actually eliminate requirements directly. Okay, it included some language that made it seem like schools can't enforce the requirements. Now, there's a lot of debate among legal scholars of exactly what this means, but I don't want to get into that. The effect on the ground in schools is that it feels like existing requirements, which are technically still on the books, are unenforceable. And this is a template that other states may be considering, and you might see similar language in your own state. The medical freedom framing of this is intentional and effective, right? It can be hard to oppose what sounds like a good thing. It sounds like you're against freedom. We have seen other attempts to soften requirements in other states. Many of you were following the news about Florida. This was kind of the most aggressive attempt to remove any vaccine requirements for schools, and this failed. Although I will say narrowly, it was a little too close for comfort. And these failed bills become templates and ideas for the next legislative session. Okay, the West Virginia story is quite complicated, but there's a legislative push to add religious exemptions and an ongoing case that will make its way to the West Virginia Supreme Court sometime later this year, and we'll hear more about that. And as you can see, there have been other laws recently passed in other states. Okay, but here's the reality. Okay, here's the reality. There's still resilient support for vaccines and school requirements. This is so important to understand. So on the left is just a quick little graph that I made. On the right is a graph that I made along with unbiased science. And we put together some of the polls and surveys that have been done over the past year to show how many people still support vaccines and support vaccine requirements. Okay, so despite the noise, despite maybe what the headlines overstate or seem to say, really the public still supports vaccines. The majority is still with people who want their children vaccinated and want to be in schools where other children are vaccinated. And this is new data that was released that I saw for the first time last week. And this is striking. So this is voters in 13 heavily Republican-leaning states that still support keeping school vaccine requirements. And a majority of them still support keeping them. Now, it's different by state. It's different by local community. But actually, a small proportion support eliminating requirements. And this is very useful in your conversations with policymakers, with school board leaders, even in your community and your state. Your community supports this. Okay, so let's take what we just learned and say, how do we communicate about this well? All right, well, first, when you're having conversations with neighbors or parents, it's so important that you lead with shared values first, okay? Do not lead with the data. Don't come out of the gate with persuasion. Lead with empathy. When people feel their values are being challenged, facts alone rarely change minds, okay? Begin with common ground. Parents want their children to be safe at school, okay? Parents want their children to be safe and healthy. You can at least find that common ground. You might differ on how you think that happens, but you can at least find that. And most want schools to stay open, and they want their families to stay healthy, right? So an easy framework is to acknowledge their concern. Validate, not validate that their concern is accurate, but hey, it makes sense why you would wonder about that. It makes sense why you'd be asking about school requirements, why you'd be asking why this vaccine is required over this vaccine, okay? Provide some evidence in a digestible way about why these are really important, and then return to the shared values. Values like having school run normally, keeping kids and families healthy, okay? And if you enter the conversation with a goal to win it, you won't. There is some language that I like to avoid, even though I've used it a couple of times in here, and I've tried to be intentional about how I've used it because over time, we have used the word mandate quite a bit. I actually like to avoid that. It sounds more coercive. I like requirements better. Forced vaccination, anti-vaxxer. Anti-vaxxer is not helpful, just shuts down the conversation, okay? COVID vaccines in this context. I cannot tell you how many times I've had a conversation or been talking about this with leaders, and there's this idea that, so many kids are required to get the COVID vaccine to go to school, okay? These vaccines are different, and different vaccines are required. Safe and effective without context is vague. It is much more beneficial to give specifics and say something like, decades of evidence and based on all the evidence we have, we know this, okay? And compliance is a word that sounds very adversarial. So a lot of these words will just trigger people immediately. And here is an important framing. This is a routine enrollment task, not a political battle. Don't get into a political battle with people about this, whether it's a parent or whether it's a school leader, okay? This is a part of standard enrollment, including vision screening, health examination, emergency forums, all those things that we do as parents every year to get our kids ready for school, okay? And this works because not only is it accurate, right? It is routine in every state, but it depoliticizes the conversation and separates it from our COVID era debates that people want to pull us back into. So describing it as standard health screening increases the receptivity from families. And look, families are confused right now, and I don't blame them. So families are asking us, why are these ones required and not these ones? Why are there different recommendations? Why am I hearing something different from the CDC than I'm hearing from the American Academy of Pediatrics? They're just confused. And they want a trusted messenger, one with expertise, one that makes a clear recommendation on what you believe is best for their child's health. They want it in a simple, digestible way, and they are looking for someone they can trust. Okay, I teach communication courses on vaccines. on vaccine communication. And at the very end of this, I have a link to a webinar that I recently gave that goes into more detail about this, because I'm not going to have time to talk about this today. But there are some simple things you can do when you're having these conversations that really help. Things like making sure you're really trying to understand with curiosity where the other person's coming from by asking open-ended questions, affirming and reflecting that they care about their child's health, and that they might have concerns about things like side effects and how this might affect their child's health because they're exposed to all sorts of stuff online. Okay. Autonomy support is great. Ultimately, this is their decision to make. Now, that doesn't mean that the decision doesn't come without consequences, right? Like not being able to attend school, but it is ultimately their decision to make. Okay. And then asking permission to share before you give them information on why the measles vaccine is important or something like that is really helpful. Okay, here's an example. A patient or a family or a parent or a student says, okay, I've seen a lot about how the MMR vaccine causes autism. How do I get an exemption for that one? That's something that you might hear. Now, the trap, what many of us that are in the science and medicine community will do is lead right out of the gate with something like, actually, that's wrong. The CDC changed their website recently. It was for political reasons. You can't trust them or anything you see on social media. Measles is bad. It can kill your child, right? So this person might be well-meaning, but you led with all of this stuff. And I just want you to put yourself in the shoes of the parent here, right? They're probably feeling a little bit defensive. They're probably feeling a little bit looked down upon, and I'm not sure they're going to be receptive to anything you just said. Instead, you can say something like, hey, it makes sense that you would have questions. There's a lot of really confusing information out there. And you want to do what's best for the health of your child. I get that. Do you mind if I share with you what we know about where that concern came from? Okay, so that is just an example of how to start leading with empathy and framing the conversation in a way that it's a partnership, that it's not adversarial. You will get much further in your conversations if you lead with that. Okay, finally, I want to just talk about policymakers and leaders. This is a different audience. So you might be talking about school leaders. You might be talking about elected officials. There are several framing points that are important. One, this is a majority support issue. That we can't say that about many things anymore, right? But this is a majority support issue. It is not actually fringe. Keep hammering that over and over and over again, okay? Requirements actually expand the freedom, not restrict it. So they protect and expand the freedom of children who have weakened immune systems, children that haven't been able to get vaccines, and others who have no choice to enjoy school, to enjoy communities that are free and of vaccine preventable diseases and safe. Okay? There's also business community alignment. Like I shared with the New York City outbreaks close schools, keeps parents home from work, right? And overall affects the economics of the community and businesses. And like I said, this is true at the societal level. This is a huge financial impact to our communities, to our states. Okay, and look, not everyone's going to support the strongest mandates or requirements. A durable policy that holds may require compromise. Options that strengthen requirements without completely eliminating exemptions include things like make them a little bit harder to obtain, make required documentation, maybe notarization, make them renew them annually. Sometimes requiring vaccine education can help. Use exemptions on a disease by disease basis instead of an all or nothing. Okay. Publish school level vaccination coverage so parents can make informed decisions. We've done this in Colorado. If you're a parent, you can go and look at the vaccination rate at your school. Not only can parents make informed decisions about their own child, but they also can join the conversation and say, hey, why are our vaccination rates so low at our school? And you can add a robust review process for medical exemptions and make sure that there's not misuse of medical exemptions. So remember, remember this lesson from Italy. There's a difference between durable and bold, right? So Italy made requirements that were very rigid in 2017 and almost immediately experienced significant backlash. And the reversal actually made the next outbreak worse. The goal is sustained high vaccine coverage, not a law or rule that lasts one electoral cycle. Okay, so durable policy builds on consensus, is communicated clearly, and is coupled with good access. Okay, and give families time to adjust, avoid creating examples and martyrs who kind of galvanize the opposition in how you implement these. Because remember, the goal is sustained high coverage. Okay, today I am not representing the view of the American Academy of Pediatrics in any way, but I do want to point out the American Academy of Pediatrics has a policy statement that was reviewed in 2025 that supports requiring the certification of vaccines for school and child care attendants. It supports equitable, timely access to vaccines, and the AP supports medically indicated exemptions only when justified. The AP also recommends all states eliminate non-medical exemptions. And the state, they are very clear that non-medical exemptions are contrary to optimal both individual and community health. All right, so I've shared a lot, and I want to point you to some credible information and other sources because I just didn't have time to cover everything. So for clinical guidance, I am sending people right now to our incredible professional societies that have really stepped up and filled a void in federal vaccine recommendations. That includes the American Academy of Pediatrics, American Academy of Family Physicians, ACOG, the Internal Medicine, American College of Physicians, and others. Immunize.org, the Infectious Disease Society of America, and the National Foundation for Infectious Diseases all have great information and clinical guidance. For patients, parents, students, I love some of these resources. Healthychildren.org has great resources. The Vaccine Education Center at CHOP is good and detailed. Voices for Vaccines and Vaccinate Your Family both have great kind of testimonials and things like that. This is not an all-inclusive list. So I'm sure on this call, some of you are thinking, oh, you didn't put mine on there. There are some other great resources. I couldn't list all of them. If you want to stay current on some of this, CIDRAP and the Vaccine Integrity Project, along with the Evidence Collective and Unbiased Science, and have been doing some great work, and I have collaborated and helped them with some of this work, helping people stay current on what's going on with vaccine policy, on what's going on with vaccines in your communities and at the national level. I also do write a Substack where I try to keep up with some of this stuff and draw in a little bit of my own personal experience. School requirements and exemption data. There's good information on immunize.org on this. KFF has good information. If you want to really get into the weeds with some of the state legislative actions, NCSL, the National Conference of State Legislators, has good tracking and information. And then as of right now, the CDC School Vax View is one of the better places to go for tracking exemptions. And go to your own local state or county public health website. That can be a really great place to go. Okay, I skipped over I just didn't have enough time to talk about school immunization requirements and communication in depth. One of my more recent publicly available webinars on communication was given for Maine Health last month, and you can just YouTube that and you can find it. I have older ones on YouTube, but that's one of my more recent ones. If you want to learn a little bit more about communication and how to effectively communicate. Okay, that was a lot. I wanted to leave time for some questions, and I'm happy to answer anything. Please follow me if you want to on social media and Substack. All of that work is a labor of love, and I do simply because I am passionate about this. And so your support really is meaningful by just simply following me. So thank you so much for having me today, and I'm happy to answer any questions.
Dr. Higgins, thank you. That was incredible. I enjoyed it. I learned a lot. Okay, so the first question that I'm going to ask you, Dr. Higgins, we got a couple different versions of this question in the chat, and I know we get it a lot out when we're doing vaccine education as well. How do you talk about vaccines in that patient visit, especially when parents have questions about like ones that are school required and not school required? I know specifically we get questions on like, like if parents come in and they say, well, I only want the ones that are school required, which in North Dakota is often, Tdap and meningococcal at that
Mhm.
adolescent visit, but not HPV. So can you talk us through, what are maybe some of your talking points? What's your approach? How do you approach that conversation with parents? I think that'd be really helpful for our audience.
Yeah, I hear this all the time. So here is what I do when a parent raises that. First, I acknowledge, I say, hey, I understand why you might be asking that question because it does seem a little weird that some vaccines are required and some aren't. Vaccines are not, vaccines that are required for school are made a requirement for lots of reasons that have nothing to do with how important they are for the health of your child. I recommend all of these vaccines today for keeping your child healthy. And I usually leave it, at that level. I usually don't get into the politics and anything else because I don't think the parents really necessarily need to know that. Usually, the parents asking, "Well, why isn't the HPV vaccine required? Is it less important?" So I just make it really clear that it's not required for a lot of different reasons, most of which don't really have to do with the importance of this vaccine for your child's health. And I think all three of these vaccines today are equally important for keeping your child healthy. I also do think it's important that your clinic staff, that even how you present it, are not separating it out. Okay, we call this bundling when we're talking about vaccines. Don't separate it out when you introduce the idea. Say, hey, Johnny's due for the meningococcal and Tdap vaccine today, and those are the school required ones. And if you want the HPV vaccine, you can get that too. Don't separate that out. Your recommendation for the child's health is all three of those vaccines. Keep it together.
Yeah, I love that. All right. So when I think about school immunization requirements, Dr. Higgins, I know it's a lot of different parts moving together. So there's the requirements that come down from the state, there's the healthcare providers who are giving the vaccines, there's the schools that are working to collect the data and report it out. Do you have any great strategies or tips and tricks for, helping those entities work together all towards the common good of making sure that kids are immunized?
Yeah, I mean, probably the most important thing is good communication. Okay, it's good communication. I love, and I'm sure there are school nurses on this call, and I just want to shout out school nurses. You're amazing. And I understand you are on the front lines of this, right? You are dealing with families who don't have their required papers and all this stuff. There's got to be good communication between people that are making some of these decisions at the level of the states, between clinicians, between local public health, and people on the ground in schools. Okay, when that communication is not happening, when there's not clear understanding of, hey, here are the barriers we're having, right? Like I all of a sudden have a rash of families that aren't up to date on their vaccines. And I'm kind of I'm worried it's because all of a sudden, Dr. Jones down the street closed his practice and they can't get in anywhere. Without that good communication about what you're seeing with each other, there are going to be a lot of assumptions made. And that doesn't help anybody.
Absolutely. All right, next question. I'm wondering your thoughts, Dr. Higgins, on what can be done to reverse this national trend that we're seeing of increasing exemption rates, and then maybe in parallel with that, what can be done to try and bring some of those immunization rates back up that have been declining?
Uh, that's a great question and a giant question, right?
Yeah.
And I love it. I would say, um, so the high points, we need to rebuild some trust. Okay, there's a lot of trust still in clinicians, in nurses, in individual health professionals, but there's a lot less trust in things like the CDC to make vaccine recommendations, maybe your state health department to make recommendations. And so we need to rebuild trust between all of those different groups and the public and parents. And that is the only way we are going to move the needle on this. It's not going to be, more evidence-based recommendations. We have good evidence-based recommendations. It's going to be rebuilding that trust, and so that when recommendations are made to communities, to families, they're asking, "Why should I trust you?" Right? We rebuild that trust, and we're going to see vaccination rates increase, we're going to see exemption rates go down.
And it really takes all of us, right? All of us out there on the front lines.
Absolutely. It takes every single one of us to do that.
Yeah. Well, I think that is a great way to wrap up our webinar today. We're right at 1 o'clock Central Time. Dr. Higgins, thank you again. That was an incredible presentation. We had a lot of engagement in the Q&A. We had a lot of people joining us live. And I just want to say thank you for joining us and sharing your expertise. A reminder, the recording and the slides will be available on our website in the next few days. And there's continuing education opportunities available for those who watch it afterwards. Thank you all for joining us and have a great rest of your day. We'll see you all back here hopefully in July. Thanks, everyone.
Thank you.